Hi, this is Amitabh Pandit here, and in this video, I'll be talking about how to cure depression and bipolar. First of all, what exactly is depression? There are many symptoms by which you can diagnose yourself whether you have that, depression or not. Number one is if you have a constant feeling of helplessness and hopelessness. Second, if you feel that you have lost an interest in your daily activities and you are restless and listless, loss of appetite, weight change, you are gaining weight for no reason or you are losing weight without any reason even though you are eating fine, or your appetite has reduced and you don't feel like eating, any kind of sleep change, you are either sleeping too much or you don't feel sleepy at all and you are insomniac and you have started staying awake in the nights for no reason at all. Mood changes such as you remain angry or irritable for no reason at all. Your reaction to even simple behavior is volatile. Loss of energy, feeling of constantly being fatigued and physically drained can also be a symptom of depression. Self-loathing, a strong feeling of unworthiness and feelings of guilt will be accompanied when you have depression. Concentration problems such as trouble focusing and making decisions are also a symptom of depression. If your body aches and you have unexplained pains anywhere in the body for no reason at all, they are also part of depression. Depression is very different from feeling low. When a person feels low, it can be for a transient time. It is only for a short time. And it is quite natural and normal that one experiences something and the things do not go right or they do not go as you have expected. You do not get the results that you were looking for and you are feeling sad and low. However, depression is a chronic problem. Depression is inclusive of all the symptoms that I have just mentioned. Besides this, we have bipolar. Bipolar is a type of depression, however, it is also categorized differently because it goes into mood swings. There are two poles, that's why it's called bipolar. On one pole, you have depression, and then there's a swing. And when you swing towards the other side, there is hyperactivity, there's impulsive reaction, there's rapid speech, and restlessness. It is the exact opposite of being depressed. Now, the number one thing that I would like to tell you about is that I repeat, do not take antidepressants for this condition. Antidepressants are actually sedatives and they numb the brain and the central nervous system. They are addictive, and even though you might feel that they're helping you initially sleep well, or maybe it takes care of the aches and the pains in the body, but no, this is not the right way to go about it. Similarly, for bipolar, if you take antidepressants for bipolar, you will make your situation much, much worse. There are 5 main reasons for depression. The number one is a poor diet. A poor diet means that your body is malnourished, it is undernourished, you're eating foods which are depleting the body of all the reserves that it has built up. You are eating certain junk foods and dead foods which are toxic to the body. And all of this leads to a toxic bloodstream. The second cause of depression is lack of vitamin D. I have seen many, many people who are suffering from depression, and when they get their lab work tested, then their vitamin D levels are absolutely negligible. In fact, there is an epidemic of lack of vitamin D in the youth and the young people of our world today. None of us are taking in ample sun rays at the right time with our clothes taken off. And that affects our body's ability to feel euphoric and having a good hormone balance. Number 3 is subclinical hyperthyroidism. Now, I'm not talking about a clinically tested, lab tested hypothyroidism for which you might be taking a medication. I am talking about subclinical hyperthyroidism, which means that when you get your lab work done, your thyroid seems to be absolutely okay, which means your TSH, T3, T4 levels are within range. But at the same time, still, your thyroid is not functioning up to the par level, the optimum level that it should be functioning, and this can lead to depression, even bipolar. The fourth cause of depression, especially in women, is hormonal. PMS, premenstrual syndrome, can lead to depression. You can be depressed after your delivery, which is called postpartum depression. You can be depressed when your menopause begins, which is called perimenopausal depression. That your menopause has just started in your life and you're depressed because there is an immense amount of hormonal changes that are occurring in the body. It is seen that for every 2 women who suffer from depression, there is 1 man who suffers from depression. So the women who suffer from depression and bipolar is much, much higher because of these hormonal changes. The fifth reason for depression and bipolar is candidiasis. This is when the body is attacked by Candida albicans, a kind of a fungus. Then the entire body's immunity goes down and your hormonal system starts to shift. It starts going down again, and it affects all the organs' functioning capacity, and it just lowers the entire body and the mental capacity of the person. So these are the 5 causes. So what is the solution? The solution is for a permanent cure of depression and bipolar. Number 1, if you are a non-vegetarian, then switch to vegan. Stop eating non-vegetarian food for some time, at least, let's say 6 months to a year, and go completely vegetarian. Now, I am not saying that you'd have to do this for life. However, when your bloodstream is toxic, or if you're suffering from candidiasis, or if you have lack of vitamin D and your thyroid is not functioning well, then when you switch to veganism, it lightens the load of the body. It allows the body to gently start eliminating the waste that is built up in the bloodstream. Second is gradually convert your acidic bloodstream into alkaline. The normal and the natural pH balance of the human bloodstream is alkaline. However, when you eat a lot of waste, bad foods, junk foods, dead foods, or you're not giving your body the right foods, there's a distinction between the two. One, you're eating foods which are bad for your body, and one, you're not eating foods which are good for your body. Both will lead to an acidic bloodstream, and an acidic bloodstream will invariably lead you towards depression and feeling low, and a chronic condition that is built up by this. So eat more alkaline foods, eat more raw, drink more juices, eat more salads, have more fruit, and eat lightly cooked foods, and avoid junk food and toxic preservatives as well as additives and flavors. Number 3, do deep tissue cleansing. Now, you can do this in various ways. Number 1 is colon cleansing. If you are constipated and you do not have regular bowel movements, or you stop yourself from urinating when you feel the urge to urinate, every time you do this, the toxic material which the body wants to eliminate will be retained and recycled. This is very, very hazardous to the body. And when you allow this waste matter to come out, you start actually purifying and cleansing the system. So firstly, get a regular bowel movement. If that is not easy for you to do, then start colon cleansing, which is you can take enemas, you can take colemias, you can take do colon hydrotherapy. It might be available near your area where you live, and you can Google it and see where it is available, and you can get it done. Number 2 way of deep tissue cleansing is lymphatic drainage, which means that you can get yourself massaged once a week in a way that your lymphatic circulation is enhanced and all this cellular waste is drained out of the body. Number 3 is kidney cleansing. You can do this with a lot of herbs that are available, and you can Google some herbs or some teas which you can use to flush and cleanse the kidneys. One of them is coriander tea. You can make it with cilantro or coriander leaves. Another one is you can use the fenugreek seeds and boil them in water and start drinking them in the morning, and that will also cleanse your kidneys. Number 4 is liver cleansing. This is a popular topic around the internet, and you might like to Google it again and see how you can do a liver flush and or a liver cleansing by eating some herbs, especially the bitters like black walnut or wormwood, or even the neem leaves that are there in India are very, very protective and strong for doing liver cleansing. A liver flush is a more intense system, and you can always Google that and see how it is done. Number 4 way of permanently treating depression and bipolar is go on a high mega dose of vitamin D. Take up to 20,000 IU of vitamin D daily and keep doing that for at least 2 to 3 months till your symptoms start reducing by 60-70%, and then you can taper the dose down and take a maintenance dose of vitamin D. This is something that you want to do for life, because vitamin D is not only a vitamin but a pre-hormone, and it is used for many other reactions, chemical reactions in the body. Number 5, check your thyroid once again. If you are suffering from subclinical hypothyroidism, even if you are taking medication for your thyroid, the right way of checking whether your thyroid is functioning right or not is not by testing your FTSH and your T3, T4, but by testing FT3, which is the free T3 and the free T4 in the body. Another way, and a more reliable way of seeing your thyroid functioning well, is take your body temperature. If your body temperature is below 98.4, which is the normal human body temperature, that means your thyroid is functioning below par. Your metabolic rate has gone down. This will show that in your case, this is the reason for you suffering from depression. The last solution for treating depression is start taking probiotics. Probiotics are life-giving to you. And when I say probiotics, you can take it either in the form of food, which is kefir or kombucha or maybe whey water. That is, you make curd, you make hung curd out of it, and the water that is drained out, you drink that water at least once or twice daily. Now, all these 3 are extremely potent probiotics. You can also take supplementation of probiotics. However, one needs to go into research as to which supplement has active and live cultures rather than dead cultures. And the foods that I am mentioning are all containing live cultures, and they are extremely beneficial. As you start following these 6 methods that I have just mentioned to you, your depression will start getting alleviated. Your symptoms will start improving, and if you are diagnosed with bipolar, you might start to come off your medication. Follow this regime that I have just mentioned. Google the ones that I have mentioned that I have not gone into detail in this video, especially the liver cleansing and the liver flush and the lymphatic drainage massage. And once you start doing that and your body becomes cleaner, clearer and purer, and your bloodstream is more alkaline, the depression will not be there. You will not need to take any medication, and if you are on medication, you can start coming off them, and gradually within 6 to 9 months you can be completely off any drugs for depression, and you will feel the euphoria that is natural for the human body.